Hello and welcome. Let's talk about sulfonamides. These are bacteriostatic and antifoliate drugs. It is mostly allergenic. The chemistry is that it is a synthetic and structural analog of PABA. It is classified into oral absorbable and oral non-absorbable. Oral absorbable includes short-acting like sulfasoxazole, sulfamethiazole, and sulfacytine. Intermediate includes sulfadiazine, sulfamethoxazole, and long-acting includes sulfadoxine. Oral non-absorbable includes sulfasalazine and olsalazine. Topical includes sodium sulfacetamide, which is eye drop, and mefenide acetate 1% silver sulfadiazine, which are used as burn ointment. And combination with other drugs includes sulfamethoxazole and trimethoprim, known as cotrimoxazole, sulfadoxine and pyrimethamine, known as fencidar, and sulfadiazine and pyrimethamine. Now, mechanism of action. PABA conversion into dihydrofolic acid. The dihydropteroate synthesis, dihydrofolic acid reductase, tetrahydrofolic acid, purine, DNA. The steps of the folic acid synthesis in microorganism. So the sulfonamides or trimethoprim act on these enzymes, leading to the inhibition of the formation of DNA. Now, it is used as bacteriostatic, and nowadays sulfonamide use are no longer recommended except in few cases because of increased bacterial resistance, allergic property, and better drug available. These inhibit both gram-positive and gram-negative bacteria. It is used as a single-agent therapy in case of acute uncomplicated UTI, inflammatory bowel disease, ulcerative colitis, enteritis, bacterial conjunctivitis, adjuvant therapy for trachoma, bacterial colonization prevention and infection of the bone wound. In case of bone, preferred drug and less toxic than mefenide acetate is 1% silver sulfadiazine. As a combination therapy, it is used with sulfamethoxazole, trimethoprim, known as cotrimoxazole, fencidar, and sulfadiazine and pyrimethamine for acute toxoplasmosis and leishmaniasis. Adverse effects include allergic reaction, which is most common, leading to skin rashes, urticaria, fever, photosensitivity, Stevens-Johnson syndrome, exfoliative dermatitis, and others. Nephrotoxicity may occur because the conjugated acetaldehyde form of the sulfonamide are insoluble in acidic and neutral urine. So there is precipitation of the drugs leading to crystalluria, leading to hematuria, oliguria, and finally anuria. The treatment for this case is adequate fluid intake and sodium bicarbonate to alkaline urine creation. Hematological disturbance like granulocytopenia, thrombocytopenia, leukomoid reaction, megaloblastic anemia, and hemolytic anemia, or headache, confusion, neuropathy, insomnia, seizure, anorexia, nausea, vomiting, polyarteritis nodosa, and psychosis. Drug interaction may be seen. The drug interaction includes there is increased serum concentration of bilirubin. There is oral hypoglycemic acid and curamine derivatives are increased in serum concentration. There is reduced warfarin serum clearance, so increased in prothrombin time. There is reduced phenytoin metabolism. The contraindication is for newborn and pregnant women in third trimester. Now, cotrimoxazole. It is bactericidal and combination of the sulfamethoxazole and trimethoprim. The composition is that sulfamethoxazole is 5 parts, which is 400 mg, and trimethoprim, which is 1 part, which is 80 mg. So 1 tab is 480 mg. Now these are the important questions for cotrimoxazole. Now, uses includes pneumonia by pneumocystis carinii in AIDS patient, sigilosis, systemic salmonella infection, complicated UTI, prostatitis, non-tuberculous mycobacterial infection, and upper respiratory tract infection, and community-acquired pneumonia. Antimetabolites. These are substance inhibiting cell growth by competing with or substituting for a natural substrate in an enzymatic process. These include sulfonamide, trimethoprim, cotrimoxazole, antiviral drugs, and anti-cancer drugs. End of the topic.